Health has become a luxury, especially in these COVID-19 times. Good health is key to being productive in our world today. And we at the Isimi Experience Retreats are here to make sure you get a kickstart to a healthy lifestyle. Now, in these conversations, we will be sitting with health and wellness experts who will give us lifestyle protocols to beef up our immune systems and ultimately live out a healthy and wealthy life. In this episode, we'll be having a conversation with Dr. Jack Emmanuel Mbom. He will be discussing health and wellness in these COVID times and giving highlights on what he will be teaching at our maiden retreat in March 2021.
I'm Dr. Jack Emmanuel Mbom. I'm a wellness and preventive health consultant, which is also known as a lifestyle health or lifestyle medicine consultant. I have a PhD in health education and exercise physiology, which means that my responsibility is to educate people so that they will not medicate, and that I'm a specialist of preventive health, meaning that mine is to ensure that I service people so that they cannot break down and they will not break down on the highway of life, instead of waiting for them to have a breakdown and panel beating them, so to say, with drugs and surgery, as orthodox medicine does. I have an interesting, fixation in my family for health. My 3 children in the U.S., my son in the U.S. Had a doctor of pharmacy degree at 24 years, 9 months. And after working 5 years as a pharmacist, went back to medical school and is just graduating now as a medical doctor and surgeon. My 2 daughters in the US, are nurses practitioners, and they are now enrolled and doing their PhD in nursing. My ex-wife in the US is a professor of nursing. My son-in-law is also a nurse practitioner and enrolled for a PhD in nursing, and my daughter-in-law is also a nurse practitioner and enrolled in a PhD in nursing. Now, the children I have here, one is a graduate in microbiology, and the 3 boys, work as wellness, and lifestyle or fitness coaches. Consequently, as you can see, across board, my family is into both preventive maintenance of preventive health and curative health or sickness management. So we definitely have what I'll call, an abnormal fixation on health. Well, firstly, I have a confession to make. I'm 68 years young. I'll be 69 years this year, July, and I have, a passion for health. I started, as the national karate coach for Nigeria. I was employed by the government as a national karate coach over 40 years ago, and a lecturer at the National Sports Institute, when a National Sports Institute was an institute of cooperation between Germany, the US, and Nigeria. And I happen to have been one of the first, Nigerian lecturers, at the institute. When I left government, I started training the Nigeria Police, training trainers for the Nigeria Police, the Nigerian Armed Forces, the SSS, and other public law enforcement agencies and private security outfits. And I also consulted for Shell, Chevron, Mobil, Total Health, and you name it. So I have been, in the industry for the past 40 years. I'm also, a world instructor in karate and a karate high grandmaster. So my experience spans not only Nigeria, but also Africa, and the world at large. Well, first of all, health is the platform on which every single thing is grafted. What I mean by that is that if you don't have health, you have nothing. And when you lose your health, you lose everything. Now, productive capacity is foundationed on good health, on skills, on knowledge, and on energy, which means that your energy is the determinant of your performance. And performance is foundation on physical energy, and physical energy is also the foundation for mental energy, emotional energy, and even spiritual energy. So if you have knowledge and skills and you don't have energy to drive those knowledge and skills, then you don't have capacity. And if you don't have capacity, then definitely your performance ability and your productivity will virtually be nil or insufficient for you to make a positive impact, whether in your personal life, your family life, your community life, or social or professional life. Well, I think that we basically have 3 or 4 lessons. Lesson number 1 is that human beings have no control and no power. All it takes is a snap of the fingers of the Almighty to put the whole world on its knees. Second is that technology and science do not guarantee healthy outcomes. Because if you look at what is going on now, the worst, rate of infections, hospitalizations, and fatality, are where? In the US and in Europe. And Nigeria and Africa are relatively, doing well. Because I'm wondering what would have happened if we had the same rate here. We'd all be falling dead like flies. Number 2. Number 3, health is not determined by drugs and hospitals. So, if it was determined by drugs and hospitals, then COVID-19 will not have the terrible, devastating impact it has in the US and in Europe as compared to Africa. Number 3 is that basically it is our immune system that stands between us and sickness and between us and death. Science is good and is, definitely something that we should support. But science is incomplete and of uncertain outcomes. For instance, global research on the pandemic has shown that, about 90 to 95% of those who have caught COVID-19 virus, who have had severe symptoms and a higher rate of mortality, are people who have what we call in medicine pre-existing medical conditions or comorbidities, like high blood pressure, obesity, coronary issues, stroke, kidney failure, etc., etc. So we can assume therefrom that if your immune system is not compromised and you are fit and you are energetic and you don't have any pre-existing medical condition, you could go through the COVID-laden environment without catching COVID viruses, if you do catch the virus without having severe symptoms, without even developing them, and if you do even develop them, with just breezing through and recovering very fast and very effectively. Basically, we have to generally listen to science, but we have to not sit down and wait to be hit by sickness before we start scrambling, to have a response. I was very interested in listening to CNN interview of the chief COVID advisor to the incoming Biden administration in the US. He was being asked by the interviewer some critical question. The first one was that, of course, the vaccines, we have vaccines, and then we have a number of them that have been approved, and some that are still, coming up, still being made. But that it has also been noticed that there are new variants of COVID, that are coming up, and nobody's even sure that we're not going to have a new pandemic tomorrow. So what is going to happen? Are we going to keep on, going for more vaccines and having 400, or more 500,000 people dying before we can start having an impact? Right now, basically all the services in the ICUs units and hospital emergency unit, all of them are overrun. And there's really a COVID medical crisis. So what do we do? How do we ensure, that we can be able to have a better and more effective response? He said, well, first of all, he believes that since there are variants that will be coming up and all that, and there's no assurance that the vaccines that are there now will be able to cover, all the coming variants, what one may have to do is keep on giving people, vaccine boosters. Like one has the flu, boosters, and also coming out with cocktails of pharmaceuticals, to be able to try to contain the situation. But the question is, have all that been able to contain the situation? They are now scrambling, to be able to vaccinate a large number of people so one can be able to reach herd immunity. But there's no certainty that even those who have been vaccinated, will not be able to recatch, or be reinfected by COVID. And then we also have to look at the fact that I preconize a different approach between public health and personal health and family health. In public health, we are merely statistics and numbers. So they can sit down and say more than 400,000 people have died. They are, thinking that by March, more than 500,000 people, Americans will die. And the president has said that, the new president has said that it's going to get worse before it gets better. The concept of public health, you deal with numbers and statistics. Individual human lives have no value. We can't afford to take the same approach when it comes to personal and family health, because we can't even afford to lose one life. We can't. In the family, if a breadwinner is gone, that family is doomed. You lose somebody, you've lost that person. So the feeling, is different in the individual American families and those families around the world, even here in Nigeria, who have lost their loved one, to COVID. For government, it's just statistic. Oh, only this percentage of people have died. In those families and for those individuals, their life have changed. So my advice is that we don't wait and only focus, on the scientific approach, because science, like I said, is uncertain, is evolving, and it has not been able to solve any problem. I don't say that we should, abandon science. We should look at science, but also there must be alternatives. You cannot talk about a choice if you don't have different options. And since the same science has proven that those who catch COVID-19, those who experience the most severe symptoms, and those who have the highest rate of mortality are those with pre-existing medical conditions or comorbidities, then we should make an effort to ensure that we can get our population to become fitter, healthier, and embrace positive lifestyle, so that we can be able to beef up our immune system, and ensure that our natural defense mechanism stand between us and disease and between us and death. One thing that everybody has to know is that bacteria, viruses, protozoas, fungi, and all those infective organisms are part and parcel of our evolutionary environment. If we look at our bodies, for every human cell you have in your body, you have about 10 to 11 bacteria, about 25 to 30 viruses. So they are part and parcel of our internal environment and our external environment. We cannot get rid of them. In fact, if we got rid of all the bacteria and viruses, we will not be able to survive as a human species. So they are part and parcel of our environment. So what we have to ensure that we do is to achieve a balance so that they do not overcome us. And the only way we can achieve a balance, so that they don't overcome us, is making sure that our natural defense mechanism, is propped up, reinforced, strengthened, so that we can be able to live with those viruses, live with those bacteria and other infective organisms without falling sick. You know that we can be 10 in this room and 1 or 2 catch malaria, and others go through without catching malaria. Just like we have COVID-19 now, there are quite a number of people who are not going to catch it. Some who have caught it and recovered, others who caught it and died. So every single one of those cases, was based on what? The effectiveness of the natural defense mechanism or the immune, response system. Coming back to your question, how do we boost our immune system? We boost our immune system, with natural protocols. What we call lifestyle medicine, which is the most effective form of medicine today, which is also, the medical practice, or the healthcare practice of the 21st century, determines a number of components or factors that are the foundation, of health. The founder of lifestyle medicine, one of the most famous medical doctors and professor in the world, is named Dean Ornish. And he started 40 years ago, through double-blind, placebo-controlled, random experimentation to show that you can be able to stop and reverse most chronic degenerative diseases, by, the application of natural lifestyle protocols. So he wrote a book. All his books have been bestsellers. His 7th or 8th book is called Undo It. How you can use natural lifestyle protocol to be able to stop and reverse most chronic degenerative diseases. That is the pillow book, the basic book that I recommend to every individual and executive today, so you can be able to eke out an effective and healthy lifestyle. And he has 4 protocols he recommends. He says, eat well, move more, stress less, and love more. I have added one component to that. Say, rest appropriately, because the body cannot repair, it cannot restore, it cannot auto-regulate if you do not rest and renew and restore. Consequently, there are 5 components of healthy living. So what I usually tell people is that health is a combination lock, and you have to key in the 5 digits of the combination lock to open it. If you key in 4 digits and a half, it will not open. And what are those digits? Balanced nutrition, regular appropriate exercise, adequate rest, effective stress management, and then balanced emotions. So these are the components. So how do we beef our immune system? Engaging in regular appropriate exercise, to boost our energy capacity, and all that, resting well to allow the body to repair, restore, auto-regulate, eating balanced to make sure that we have the right type of, fuel to be able to ensure that the engine works properly, managing stress, so that we can be able to avoid, intoxicating, the body, and then building positive, social relations, to support us and to provide us with balance and positive emotions.